Hello and welcome to the Patient Advocate. My name is Richard Longland. I'm your host for today. And today we're going to have a special session. We have two lovely ladies that are both registered dental hygienists. Say hello to Sarah Coyne.
Hello.
And Madison Montgomery. So we're going to
there.
cover a lot of different topics, but we're just going to get right into it and sort of start at a general level, then focus in on some tricky questions. But in the next session, the next half-hour segment, we'll talk about just simple everyday things that any one of us can do and should do to practice good oral hygiene. So let's get into it. We'll start with you, Madison. The basics. What is a dental hygienist and what do they do?
So what we do is we're a group of professionals that assist anybody and everyone in oral care. We go to school anywhere between 2 and 4 years and are degreed, and work under the license of a dentist depending on what state. There are some states where we can work independently, and in some states we can give anesthesia, do fillings, but primarily our #1 goal is to educate and create an awareness of oral health for the public and our patients.
So Sarah, drilling down just a little bit, pun intended, what do you do as a dental hygienist on a daily basis?
So on a daily basis, I am in clinical practice. I see anywhere from 7 to 10 patients a day. And like Madison has mentioned, we primarily do quite a bit of education. We do a lot of life screenings as far as not only just educating in oral hygiene, but checking blood pressures and really assessing your oral health care as a window to your overall health.
And just to remind some of the viewers, recently I interviewed my new dentist, Dr. Jeff Corbett, who Sarah works for. And one of the reasons why I chose this practice is not just because of Sarah and Dr. Jeff Corbett, but also because they're more educated about treating biofilms. So tell us a little bit more about the kinds of everyday treatments that you do to help patients get rid of biofilms.
So in the office, one of the things that we pride ourselves on is utilizing a technology called ozone therapy. And this is activated oxygen, which is nature's best way of killing bacteria without having to use chemicals, without having to use antibiotics. So that's something that we utilize in our ultrasonic method, which is a way of cleaning teeth with water. And then we also utilize it in oils and gas form as well. That's one of the major things that we pride ourselves on there. We also do a couple other little screenings to test pH levels of your mouth, and also we can do oral DNA tests, which can tell us what types of bacteria you have in your mouth, and we can treat you specifically geared toward those bacteria.
Good. And of course, we'll get into that in more detail later. Now, Madison, you and I met at a dental conference a few months ago.
Yes.
And you're no stranger to biofilms, but especially regeneration techniques. What is regeneration from a dental perspective?
From a dental perspective, periodontal disease, as we all know, is prevalent throughout the U.S. And there are technologies now that enable us to not only eradicate the disease, but also grow back, if you will, a functional periodontium, which means the alveolar bone, the periodontal ligament, and the cementum. And there are different products with different amounts of science behind them on the market, and that's what I was doing at the time. I'd been a clinical educator for a company throughout New England, educating specialists, general practitioners, oral surgeons, and periodontists on the regenerative therapies that we have and why it's so important, because primarily, most patients start off in a general practitioner's chair. That's really what we call home base. And then when that particular patient needs something more than that particular office will offer, then they are referred out. And so the more the dental community has an awareness of one another's skill levels and skill sets and technologies, then there's continuity for patient care, and then patients are receiving the best of both worlds. And it's also a nice way for a patient who does need to have a more serious or more determined type of care. It's nice that those practitioners are talking the same language. It's a warm handoff. It's just like if you needed to go buy a car, you asked a friend, who am I going to go to? You're going to go to somebody you feel comfortable going to because they were referred through a friend.
Got it. Before I get ahead of myself, I think I am already.
Jump into those biofilms.
well, you know, a lot of us get lost in terms, and I'm still myself confused about some of these terms that are used interchangeably. So each of you, please help me with these terms: plaque, calculus, tartar, and biofilm. Sarah,
Okay.
let's start with you. So are these all the same things or not?
Oh, they're related.
Okay.
They're certainly related. So biofilm is a matrix of bacteria that adheres to a surface, and so that's what I do on a daily basis. I say I fight biofilm all day. Primarily where we're going to see that is on, you know, the surface of your teeth and along your tissues. Plaque is actually a combination of bacteria and food that sticks to the teeth, and what starts the onset of breakdown of the teeth, decay, and is also within biofilm. They are definitely related, as is tartar is the hardened form of plaque. So when you have that calculus or buildup on your teeth that doesn't come off, and part of the reason why most people come to see us, that is the hardened form of plaque, all of which collect bacteria, all of which produce acidic levels, all of which start an inflammatory process.
Excellent. That's very clear. Anything to add to that, Madison?
No, other than, you know, as she had mentioned, but for some that might not have gotten it, that tartar and calculus are interchangeable. It's just the hardened form.
Okay. Now to get into some fun controversies about biofilms, okay? At least preface it. Just recently I was attending the ADHA show, and I was stunned to learn that there was a dental hygienist who works for a company that I won't mention. She won an award, and I remember specifically having this heated argument with her a few months ago about biofilms. And the contention was that there's no clinical evidence whatsoever to support the notion that oral biofilms that are pathogenic can cause problems elsewhere in the body. So I see at least 40 years of clinical evidence going back to Dr. Lloyd Rudy, who excised close to 1,000 different heart valves and actually examined every single one of them to identify oral pathogens. So putting that and hundreds of other cases aside, can you speak to this issue? Why is it still controversial?
I would love to speak to this issue.
Yeah.
I would. I think number one, there's a lot of our industry, the medical industry, the dental industry, the technology and the information comes at us at rapid rates. And it's almost a full-time job in everyone's defense to maintain a level of higher education. But that being said, it's what we're supposed to do. So there is much information. I agree with you. I would say that that particular person needs to be educated, because I have spent 4 years doing that for companies and educating surgeons and doctors.
I agree. So let's get into this. So this person is an educator. I mean, that's her professional role. Now, to get into some of the technical aspects of definitions, all right, there's different levels of clinical evidence, right?
Yes.
So I think what's going on here is that there are certain guidelines to establish the credibility of clinical evidence. There's level 1, there's level 2, there's level 3. Does that really matter? Do we need to get lost in these discussions that become very technical and very legal? Or should we just practice what we already know here? Good oral hygiene will keep you healthier. It'll keep your heart healthy. It'll keep your veins and arteries clean. I mean, help us untangle this so that the public can really try to get the takeaway lesson here that makes sense to them. Sarah, would you?
Yeah, I think one of the interesting things, and you know, kind of going back to this individual who says there's no clinical evidence, I think we have to be careful, because one of the things we do know is that there's a link between these two. It doesn't necessarily mean that if you have this particular biofilm or this specific makeup, you're going to have a heart event or you're going to have diabetes. But the link is definitely there. That education is there. And I don't think you need to have any specific criteria on this evidence. It's there. The studies and research are there. It's supported. It's supported to the point where insurance companies are now covering for a diabetic patient to have more than 2 cleanings a year. somebody who is had a bacterial endocarditis event in the past, a heart issue, to have more cleanings a year. The link is definitely there. There's definitely a relationship there. And I don't think there's any specific criteria on some of these studies that needs to be in place. The research is there, and we should keep going forward with it.
Well, you raise a good point. I mean, if the insurance companies, who are notoriously frugal in reimbursement, are willing to help diabetics keep a clean mouth, I think that speaks volumes about the efficacy of good oral hygiene and systemic health. So thanks for that. Madison, you were going to say something?
Well, I think that the number of clinical articles alone that was published last year just in J. Perio, I believe there was somewhere around 12 that I can remember just from the fall, probably sometime around June, July. So I think it's an awareness too. Sometimes educators, and I mean no disrespect, sometimes you can get caught up in just what it is that you do and the company politics versus pursuing the information more outside your own. And we have to do that because it is there. It's absolutely there. It's made Time magazine. Again, you had mentioned, I think I had a slide from you where they've shown the dental plaque seedings and heart valves. I mean, the research is there. So I think it's up to everybody to not only toe the company line when they're a clinical educator, but as a hygienist, it's also up to you to pursue your own education outside of those guidelines for credibility and patient care for everybody involved.
That's a really good point. So just off the top of my head, the conditions that I've heard are linked to oral bacteria and oral biofilms, everything from arteriosclerosis to diabetes, all kinds of inflammatory syndromes, and even rheumatoid arthritis. I happen to know several different rheumatoid arthritis patients who have gotten better, significantly better, or feel better and have less pain and less inflammation just by getting their dental problems resolved. So again, I think that speaks volumes about how important this kind of information is. So I want to go back to something you mentioned, Sarah, which I think is pretty cool. I haven't taken advantage of this technology yet, but let's talk a little bit about, I believe the company is Oral DNA. What is that test about, and are there different kinds of tests from that company that can help patients figure stuff out?
Yeah, so Oral DNA looks at, when we assess a patient, we look to see what stage of health they're in as far as their oral health goes, and there's generally a gingivitis stage, a healthy stage, a gingivitis stage, or a periodontal disease stage. And so we know that there's specific bacteria that are linked to the severity of your disease. The neat thing what Oral DNA has done is they've given us an opportunity to take a sample of a patient's saliva and test that, and then given what types of bacteria they have in their mouth, we can treat them with antibiotics specifically geared towards those bacteria. That kind of helps to get them into a better, healthier place. And then with that, then we can control the patient, given home care, given diet, given knowing their medical history. So Oral DNA has become a great leader in just how we specifically treat a specific individual on their situation.
And is this something that insurance covers, or is it relatively inexpensive?
Some insurances are covering it again, and I think you have to kind of go in and ask your company, especially if you have a history of like a diabetes or a cardiac situation, even pregnancy, that you can go in and ask them, you know, would I be eligible for coverage on that? If not, it tends to be, you know, I always say it's a cost-effective way to find out how to get yourself healthy without having to live an inflamed situation for too long and have, you know, further issues down the road, more costly and more expensive.
Exactly.
Yeah.
I think that's one of the things Sarah brings up a really great point is, and again, I think it comes down to how succinct and how well educated we do our jobs when the patient's in the chair, because words mean different things and the patients will take you literally. So if you say that's normal, right? When there's a little bleeding or calculus, that's never normal. It's common, it's not normal. And so those types of things make a difference. And what Sarah was just saying is with the insurance, it's important for everybody to understand that insurance is a benefit. You know, it's a little added bonus to help you. Preventative care is the least expensive way to maintain your overall health, because the problems are only going to get bigger. So when someone says we're going to watch it, you're actually going to watch it grow and become more expensive. And nobody in this economic climate, I think, wants that. And it's not good for your health. So
going back to these specific kinds of tests, and this is kind of an unfair question because I'm asking you to be sort of a data analyst. I assume you've done dozens, maybe hundreds of the oral DNA tests by now in your practice. Do you have the ability to actually make any assumptions or conclusions about the data you've seen from your patients? In other words, what kind of patterns do you see in the data? Do you see that the more bugs that are found in a person's mouth, the less healthy their mouth is? Or have you identified that there are certain pathogens like the gram-negative bacteria that are causing most of the problems? I'm just trying to get a better sense of how you're using it as sort of a conclusive diagnostic tool.
Yeah, it has become an interesting kind of learning tool for us as well in the practice. And yeah, we've been monitoring just what we've been getting for results back in as far as, you know, what types of bacteria there are and how we're treating these patients and what their history is, you know. And right from you know, results from oral DNA, you can see, I mean, very rarely do you get a medical history that comes in and somebody who we've tested with an oral DNA that needs treatment and therapy, and do they have a you know, generally healthy medical history. So, you know, and it could be family history, it could be, you know, a recent diagnosis, but we're actually doing a lot more tracking that way, as well as finding out, you know, let's see what this person looks like as a, you know, a generally healthy person, and, you know, how can we help them that way as well, you know. So, and again, it comes down to the mouth being, I always call it the window to your body. So, you know, what we get from this oral D is just confirmation of everything we've been taught and kind of have been trying to educate more and more on, and trying to educate ourselves more and more on. So it's the company's tending to be a great confirmation for all of us, really.
Excellent,
yeah.
Excellent. So I want to talk about two special groups of people.
May I just add something to that? I think what's really important to what Sarah had said is that it's the window to your body. So many patients say, oh, it's my teeth or it's my mouth. They don't realize or think consciously it's inside my body, and it really is one of the first places we can see where there are systemic issues. And that's a really big thing for people to understand. It's one of the first places something's going to show up. So it is a huge tell-all. And again, I think it's education, because 80% of the population is periodontal disease and they don't even know it, because it's considered normal in so many places versus common.
Well said, and that's a lot of people. I mean,
it's a lot of people.
I'm always trying to get a real number on that, but, you know, is it 100 million people? I think roughly. But it's too many people. It's
far too many people.
So let's get into the more vulnerable populations, that people that really need to know more about the basics of oral hygiene and how to do the common things uncommonly well. So firstly, congratulations to Sarah, who is pregnant.
Thank you.
And you're how far along?
Almost 30 weeks.
Wow.
Yeah.
That's a big deal. So you know better than most how critical it is to practice good oral hygiene.
Mm-hmm.
So I refreshed my memory on some studies that were done years ago in Finland, one from 2001. Bear with me while I read the title to the audience. The Influence of Maternal Xylitol Consumption on Mother-Child Transmission of Mutant Streptococci, 6-year follow-up. So basically, this study has proven that xylitol, which is a simple sugar, is safe for you for diabetics as well, but it actually helps get rid of biofilms. So let's talk a little bit more about the kinds of practices that moms should know about when they're pregnant, and also can we superimpose that same knowledge for pre-surgical patients? In other words, people really have to be attentive to their oral hygiene. So Let's start with xylitol.
Yeah, that happens to be one of my favorite studies, actually.
Mm-hmm.
I got real excited about that because it's just so simple.
Mm-hmm.
You know, who thought we'd be telling people to chew gum now, you know, as dental hygienists? So, and the reason being is because when we're born, we really don't have that bacterial infection or biofilm in our mouth that triggers the cavity response. It's transmitted from mother to child. We test a spoon, we drop a pacifier, we clean it off with our mouths, we stick it into the child's mouth. And so, you know, kissing is contagious. Cavities are contagious. So xylitol is a really exciting product that their little motto is strive for five times a day. So it comes not only in gum form, but it comes in candy form now. And they're kind of working it into like lozenges and other types of material, even rinses to use. So that they've actually found that we're reducing decay in children. So by a mother who's pregnant chewing this gum 5 times a day, you're kind of altering your bacteria, and then, you know, our chances of transmitting this to our children are minimized. And so, you know, the future of that is huge. I mean, the best preventative means we have for decay in kids right now is sealants, but wouldn't this be so much easier?
Sealants in education. I think it all comes down, I think there's been some studies that have been put out that actually show that, you know, caries is the #1 disease. You know, there's obviously a list of them, which I'm sure we're going to get into, but the sugar in our society is so high, right? The processed foods and the soda and all of that comes through education, and people, I think we take it for granted, and that somewhere along the way, you know, good food, right, healthy food is considered boring, and, you know, everybody wants to go for the sugars and the sweets, and they don't realize exactly what they're doing. And I'm not saying don't have the cupcake and the treats, and I'm just saying there are hidden sugars in everything. And so it comes down to awareness and education, and the more we can do with that without without badgering or boring the patients, but a little bit here and there, it makes a huge difference. Because, I mean, look they have candy machines in the schools. That's crazy.
Well, things are changing. Thank God for that. Let's continue and bulletize a list, if you will, for the audience. So we talked about things that we can do every day. Xylitol, strive for 5, you said. And that can be toothpaste, mouthwash, berries. What else can we be doing on a daily basis? Again, with a special focus on people getting ready for surgery who are going to be intubated to make sure they have a clean mouth. For pregnant mothers, what are these other common things we can do? Let's talk about the basics. Brushing and flossing,
Flossing, flossing correctly. A long piece of floss, using clean floss, a new section of floss in between each and every tooth. And if that's something that you feel is difficult for you to do, you can call your dental office and they'll show you how to do it. They'll show you different products you can use. There are little Christmas tree brushes if you have spaces between your teeth. There are flosses that are called super floss that look like yarn that get under bridges. So there's many different things that you can use that will enable you to eradicate the plaque or get rid of it on a daily basis. Also brushing. Another big one I think is cleaning your toothbrush off after you use it with cold water, because so many people run it under hot water thinking they're, you know, cleaning it off, and what you've done is you've just left whatever bacteria is on there, and now you've just infused it with some heat, and it's sitting there in your bathroom cooking.
One dentist I interviewed said you could put it in the dishwasher or the microwave. And of course my retort was throw the darn toothbrush away and get a new one.
Get a new one, right?
Exactly.
Yeah.
Exactly.
And soft, extra soft, what's the verdict on that?
I'm a huge fan of soft because most people brush aggressively as it is. I think that's a big thing. You know, we live in a stressful society, and learning how to brush properly, and we also think, oh, well, you know, we have what I call the Uber users. We teach them to do it one way and they want to be the great patient, and so it's with heart. They think they're going to brush better, so they get, you know, I want to get a really good grade at my next cleaning, and they don't realize that, you know, when the bristles start to look like this, you're actually doing damage. So all of those little things, I think, come into play over time because everything you put into your mouth is actually cleaning off what you just had before, basically.
Yeah, and then there's some technology, the electric toothbrush, my favorite tool ever.
Which
Yes.
one? The ultrasonics?
You know
or?
what? Yeah, well, you know, the two competitive ones are Oral-B and Sonicare. And they both are highly competitive brushes, but both a great instrument, you know, both proven to do the better job, minimizing your chances for those aggressive brushers to do any damage to the tissues. I always caution mouthwashes. Now, there's a bazillion products out there, and they all claim they can kill everything. Sure. But if they're high in alcohol content, you bet that they're going to the bacteria to come back tenfold within, you know.
Really?
Yeah.
Why is that?
Because the high alcohol content, it dries out your tissues. Mm-hmm. And so one of the things, you know, kind of just daily brushing, you know, rinsing with warm salt water would be a better benefit even. Kind of putting that high alcohol content in your mouth to dry out the tissues, and then we go and we eat all day or we sip on beverages all day. I can't stress enough how dangerous sodas are or Gatorades are to our teeth, and, you know, just kind of causing an increase in inflammation in our mouth. So
what about good old baking soda?
Baking soda is great.
Yeah.
Baking soda is great. And the other thing to add to what Sarah just said is so many people say, oh, my mouth is dry now, and then they suck on candies. And they don't realize that they're just feeding the bacteria a consistent supply of sugar all day long. Brushing the tongue is another good thing, because people don't realize the taste buds on your tongue, if you were to look at them under a microscope, all look like little mushrooms. And so by brushing, you're cleaning all the nooks and crannies on your tongue. So all of those things matter, and lots of water. We seem to be a society that doesn't do too much water anymore.
Yeah.
And I'm sorry, go ahead.
And just to add to the, if you are preparing for something like a surgery or something of that nature, or you're pregnant, or one of the things you definitely want to do not only is your home care, but you do want to be seen by a dental professional. You do want that evaluation done. We're going to be a huge important piece of information as far as giving you some of these educational tips and what was going to work best for you, kind of guiding you dietary-wise, guiding you as far as product goes, guiding you as far as how you can get yourself healthy before you get into a surgery, and in some cases they're asking for dental clearance now. So.
Great. That sounds good to me. So cardiac surgeons are coming to you, or what kind of doctors are looking for a blessing from the dentist and the hygienist?
I would say it's cardiac would be the number one because of the link. And that actually was written up in Time magazine not too long ago. So there is definitely a huge link between cardiac potential incidents and periodontal disease. Actually, as I had mentioned earlier, Dr. Nordquist has a book out called I think it's called The Silent
Silent Killer.
The Silent
Right.
Killer. And I just ordered this. I was talking to Brian this morning on the phone, and he actually makes a point to mention that there is enough, obviously more than enough, information out there that shows that there is a link between the life cycle of the bacteria, the spores they put off, and whether we're muting the disease. And it all comes down to, too, how well the patient's going to adhere to what we share with them. We can't go home with them and make them do it. They have to want to take care of it, and they have to understand the link.
Well said. So we are just scratching the surface here today. So I think we're going to wrap it up for now, and when we come back, we're going to continue talking and probably get into more detail on some of these subjects since they're so important, and since there's a greater awareness now of how critical your jobs are in helping people get well. So thank you so much for being here today.
Thanks for having me.
Thank you.
So thanks again for joining us today on The Patient Advocate, and we'll leave you with a few reference websites to take a look at. So peace and good health to you always.